to verify my doctor's orders for IV placement. I'm going to correlate my IV history, so I'm going to make sure if the patient's had a mastectomy, if they have a dialysis fistula, if they've had a stroke and have a weak side that I shouldn't be doing the IV on, and their size so that I know what size of catheter I should be using. I'm going to gather all of my supplies. I've got my tourniquet, my Tegaderm, my gauze, my tape, my J-loop, my alcohol swabs, my gloves, my IV catheter, and my flush. So I've got everything I need, and my blue pad that goes under the patient. I'm going to knock on the door, wash my hands, introduce myself, and identify the patient, provide for privacy, explain my procedure, and make sure that the room is safe, bed is locked, those kinds of things for the patient and myself. Verify allergies with the patient, especially latex and adhesive. And then I'm going to explain my procedure. I'm going to be doing an IV on you today. You're going to have a little poke, and when we do that, we withdraw the needle and leave a little plastic flexible catheter inside of your vein that'll help us deliver medications and fluids to you without having to poke you a whole bunch of times. Allow your patient to ask questions, and then I've done hand hygiene, so I'm going to put the tourniquet on my patient. Real arms don't roll like these, I will tell you. Make sure you get your tourniquet tight. I'm going to look for a vein. I'm going to go with this one here. Release my tourniquet. Get all my supplies ready. I'm going to open up my IV catheter.
Did you glove up first?
To open the supplies, you can. It just depends. I can glove up first. I usually open them and then glove, but you can do it either way. Everything's still sterile until you take the caps off, so either way is fine. This, you want to make sure that the blue tip stays sterile when you're opening it, because that's the part you're going to hook the flush to. If it does get contaminated, you need to clean it with an alcohol or chlorhexidine swab, and then you can go ahead and attach it. Attach that on there. Make sure this is unlocked. It should be when you get it out of brand new packaging. And then flush to prime your J-loop. Okay, there's no bubbles in it. I like to set mine back in the packaging just to make sure it stays clean. You guys will be using at your clinical sites the IVs with the buttons on them. This button automatically retracts the needle with a spring, so if you bump that button, your needle's gone. So you need to be really careful not to bump that button. You want to make sure when you're inserting the catheter, when you go to advance it, that you don't touch this. See where the blue meets the clear here? You want to make sure that you don't touch that, because then you've contaminated the site where you're going to hook your J-loop to. There is a little teeny tiny tab right here that you can use to push on to advance the catheter, or you can stabilize it and advance this way. You just need to be really careful not to touch that part of it. So I wanted to show you guys that. Get my tourniquet up. Get my alcohol swab. Ten, 20, 30, clean. Allow that to dry, don't fan it, don't blow on it. Actually, before I pull that out, I want to open my Tegaderm. So you want to take it out of the outside packaging, but you don't want to peel the back off of it and lay it, because then you contaminate it and it's a risk for infection. What a lot of people like to do is take this and just fold it back so they can easily get a hold of that to peel it apart when it's time. I would take my pen, do my initials, today's date, and my gauge. It's a 22. So I've got that ready. Okay, I'm gonna pull back down here, go to 10 to 30 degree angle, in, got flashback in my chamber. So then I'm going to advance my catheter as I pull the needle back. It's in, so I can go ahead and occlude up above here, retract my needle, take my tourniquet off, get my J-loop, hook it in, it twists in, screws on there, make sure it's tight, but don't twist the catheter in your patient's arm. You can stabilize it back here to get your hand out of the way. Don't touch the inside of the tegaderm with your gloved hand. And you want to bring this tegaderm back over top of the connection site to prevent infection and provide more stabilization of that catheter. You want to push the tegaderm down around this. It doesn't work as well on these little arms as it does on real people. Secure that down so that there's not air where infection can get in. Pull this off and smooth it out so you don't have rolled edges or big bumps and bubbles in your tegaderm. Take your label off of here. Put it alongside. Don't ever cover the end of this anywhere up through here because you want to be able to see the end. Your catheter is about this long, so this is about where you would start to see infiltration or problems. And I need to back up because before I put that tegaderm on, while I was still holding on here, I should have flushed this. You pull back just a little bit to verify you have blood return, and then you flush it in. On these, don't flush your whole syringe, just a little bit, and make sure that it's a good IV and that you don't see any infiltration or signs of the vein blowing. So I would have flushed that, and then I can lock this. So I'll back up just to tell you guys, I would have held onto this, pulled back, flushed, gone ahead and placed my tegaderm, locked this, taken my syringe off, used my tape, if I can find the end. I like to throw a piece back here just to help stabilize that a little bit better. Bring this up alongside here. Stabilize it down. And I usually just do one more piece down here so that that doesn't catch and rip their IV out. Okay, so my IV's in. Ask your patient if they're okay, give them their call light, make sure that they're comfortable. And then you're going to come back and you're going to take the IV out a few days later. So you're going to knock, you're going to wash your hands, introduce yourself, go through all of your K-wipes with your patient. When you come into the room, let them know that you're going to be taking the IV out. You're going to assess the site for redness, swelling, infiltration, phlebitis, any of the things that we're concerned about. And then I'm going to start taking the IV out. I've got my gauze, I've got tape to put over it as the bandage. I've got clean gloves on. You guys can go ahead and verbalize in your pass off that you would change your gloves and put clean ones on so we're not using a whole bunch of them. And then I would go ahead and take this IV out. The worst part is taking the tape off. You always want to make sure you stabilize because you don't want to pull this out while the dressing's still on there because you could hurt your patient and damage the vessel wall. Make sure you don't touch the insertion site because that's a risk of infection. So pull that back to where you're not stuck to the skin anymore. Grab your gauze. Alright, you're going to feel me pull this out. I'm not putting any pressure right now. I'm just holding it over top of it. 1, 2, 3. Okay, my catheter's intact. There's no problems with it. Patient's doing okay, so that would go directly in the sharps. I would put my tape on for my bandage, and then I would go through and I would document. And off the top of my head, I don't remember everything I have on here. I will admit that. So I would need to go through and I would need to document my time, my gauge, my site, my status, whether it was locked or infusing. In this case, it was locked. How my patient tolerated the procedure, how many times the patient was stuck. In this case, the patient was stuck once and had a successful IV, and any complications, there weren't any complications of the IV insertion. For the DC, I need to document the time. If the catheter is intact, the catheter was intact when I removed it. Status of the site is dressed with gauze and tape, and no signs of bleeding at this time. Held pressure for about 30 seconds. If I have a patient who is on blood thinners, I'm going to need to hold pressure for 5 to 10 minutes in order to get that to clot off and allow it to stop bleeding. If there were any complications, there were no complications of the removal, and how the patient tolerated the procedure. Patient tolerated the procedure well. I didn't have any signs and symptoms of IV-related complications. If I did, I would need to notify the healthcare provider right away.